So next up, we have, as a good follow-up to this discussion, we have Catherine Hoell, is a physical therapist specializing in orthopedics and golf rehabilitation. She received her doctorate degree from Mass General Hospital, Institute of Health Professions in Boston, and board certified in orthopedics. Catherine is a lead physical therapist at Cape Cod Healthcare and holds the highest degree of medical track certification through Titleist Performance Institute. Catherine practices physical therapy in Chatham at the Oppenheim Medical Building. And today, Catherine will discuss how to care for your spine and how to get back in the game with physical therapy. And I'm hoping Catherine will also get them to stand up and move and be a little active here. Yes,
It's
thank you.
ready, right?
Thank you.
Thank you very much. Thank you, Dr. Siddhartha, for putting this all together. Thank you all for coming out. This is awesome and a lot of information, right? So today I'm going to talk about getting back in the game with physical therapy. What game am I talking about? Whatever game that you're playing. In my clinic, I see a lot of golfers who come for rehabilitation. Some have had surgery, some have not. They're trying to avoid it. And we take them through the rehabilitation spectrum, through golf performance. But today is not a golf talk, although it could be. Getting back in the game, I'm really speaking to your game, whatever that is. I'm just curious, how many people are golfers? It's Cape Cod. We have a lot of golfers. Excellent. I see a lot of tennis players here too. Who plays tennis here? Okay. And then there's this kind of a funny game that's new, but I love it. I tried it. It's called pickleball. Who played pickleball? All right, a few of those. So maybe I've spoken to the game that you play, but maybe it's just gardening. Maybe it's getting back out riding your bike. Maybe you've had some of these symptoms or diseases that Dr. Hoell or Dr. Wilsterman has talked about today. We're going to try to look at some strategies to avoid having surgery with them. So when I go through things, that was my laser pointer. When I go through my talk, I want you to think about your game and how some of these principles apply to you for keeping your back healthy. So the slide here, have you ever heard of a spine transplant? Neither have we. So take care of the one you have, as good as Dr. Hoell is. He can't replace the whole spine. So a lot of you had questions for them. How do I avoid that? And that's what we're going to talk about today. So when I was looking at the literature for who's really at risk, how bad is it out there in America? How many of us are really dealing with back problems? The answer is it's a lot. It's a lot of people. So I could put up statistics about who's at risk, but basically we're all at risk. Except for one demographic. There was one demographic in the literature where they really didn't report a lot of spine problems. And those are people under the age of 10. So not that they can't have spine problems, they can have congenital problems in their spine, but they're not going to get that weekend warrior or that spine back pain issue that we all are at risk for getting. But what I found interesting in the literature was there were some risk factors that make you more at risk than the person sitting next to you. And that's what I found interesting, that it kept coming up. So that's what I want to go over, is what are the risk factors that make it worse? Come over here. So one of the risk factors is genetics. And we can't change that. That's thanks to mom and dad. So some people are just predisposed to getting back problems more than others. And a lot of it has to do with the curvature in your spine and how those curves kind of line up when you're born. And you've seen people having a sort of a family of back troubles, right? If you have back trouble, probably your mom and dad had back trouble. It's just, that's my family. But some things you can change, and that's what we want to talk about. So obesity, that is a risk factor. It's not the only factor. I tell my patients in the clinic, if that were the only factor, then skinny people wouldn't get back pain, and that's not the case. So, but I'm excited for Diana to talk about some of the nutrition, because if you look at portion control, if you look at eating the right kinds of foods, that can help with your weight control and reduce your risk of back problems. Smoking, I don't need to say much about that, but I know some surgeons who won't even operate on people who smoke because the recovery rate is so bad. bad body and lifting mechanics, and that's what we're going to go over today, that can put you more at risk. So if you're lifting with poor mechanics, or you're sitting at your desk all the time, or how you're sitting, we're going to get up in a second because I know we've been sitting a long time, but that can actually increase your risk for back pain. And then weak core and poor physical condition. If you're out of shape, that is going to increase your risk for getting back trouble. And the weak core, everyone talks about the core, and we're going to go over that, but the core is really just an area in your body. It's not one particular muscle. It makes up your abdominals, your diaphragm, how we breathe affects your back pain, and also the gluteal muscles. So we're going to go into that. So exercise can help prevent back pain. And Dr. Hoell was right. We can't fix ligament or degenerative bone. We can't fix that, but you can do things through exercise that can help to prevent you from where you're at the point of no return. And I think that's really important. We need hope here in this room. But it has to be the right kind of exercise. So probably you're motivated after this talk, okay, I'm going to get out, I'm going to exercise, I want to prevent back pain and everything. And you go to the gym and you're on the treadmill and you're 45 minutes in the treadmill, and then you go do some weights, and then you're like, oh, I'm going to eat right, I'm going to eat my smoothies and do all the right things. And you maybe do that 1 or 2 times, and then what happens? You overdo and you get injured. And you say, yeah, see, exercise is bad. I probably shouldn't do that. So it has to be the right kind of exercise, and you're going to find out what the right kind of exercise is. And that's really important. I'm even going to give you a program that you can start right when we're done. So as a physical therapist, we're movement specialists. I'm in the business of getting you moving again. So physical therapists assess joint and muscle function to figure out which exercises you need. So it's not a cookie cutter. I have given you something today that you'll leave with, but it really is customized because everyone's a little different, right? Everyone has that different genetic disposition. So we really need to assess you and see what's going on, what your muscles look like, how they're imbalanced. Dr. Hoell kind of touched on that, and we can assess that. So the slide said, what fits your busy schedule better, exercising 1 hour a day or being dead 24 hours a day? So, because I'm bringing up exercise, and everyone's like, oh, isn't there just a pill or an injection? Or maybe there's a bone fragment. He can just, take it out, and then I'm good. It's 1 hour a day of exercise is only 4% of your day. You can make time. So before I just start talking about exercises and what's the most important thing, I think it's important for you guys to understand how we come up with these exercises. When you come in for back pain, you see physical therapists, sometimes you might leave going, why did she want me to stretch my legs out? It's my back I'm coming for. So I think it's important. Let's sort of become anatomists for a second, because I look at myself as a body mechanic working on your body. So if we look, I want to kind of look under the hood of the car, so to speak. Let's kind of see what's going on. So let's see. Every joint is designed for a purpose, and I think that's really kind of interesting, because you've seen all these talks about joint replacements and how to replace them, but what actually is it? So we know the hip and the shoulder are a ball and socket joint, but what are they designed to do? So every joint has either one of 2 functions. It's either designed to mobilize you or stabilize you, okay? And I think that's really interesting. And when I started looking at this, it's actually a really cool design, because when we look at the foot, it should be sort of a stable joint. And then above it, the ankle is a mobile joint. And it really goes up a kinetic chain. So then the knee is sort of a stable joint. The hip is a mobile joint. We want it to move. But what's the key here, because we're talking, coming off of Dr. Hoell's talk about the back, is look what the low back is for. The low back is actually designed for stability. So when you hurt your low back and you say, oh, okay, I'm just going to stretch out my low back, you're actually stretching out something that is really designed to stabilize you. It shouldn't have a ton of mobility. The spine is broken up into 3 parts. And so what we look at, so if we see that the low back is a stable joint, look at the middle one here, the thoracic spine. It's where your ribs attach to your spine, that's actually where you should be getting the mobility. So when we're looking at a good program, we should be looking at stretching out the middle of your back, not so much the low back. So that's sort of the take home. That's my point for this slide, is just understand that there's a design for each joint, and there's an exercise best on how to work that joint. So here's the thing. If the joint doesn't do its job, so let's say you have tight hips, right? A lot of people get tight hips, you sit too long, and you lose your mobility. Here's the thing, our bodies are very good at compensating, so the next joint is actually going to steal some motion. And when you have tight hips, what's the next joint up? It's your back. So a lot of times people, when they lift, right, they have to bend down to pick something up, and they don't have the hip mobility to do it. Oh, that's all right. I'll just bend my back, right? And we make that happen. So that's why a lot of times we'll say you need to lift with your legs, not your back. Everybody knows that, right? But few people can do it effectively. A good exercise program can help you do that better, putting less stress on your spine. Does that make sense? So joints are a factor, but also weak and tight muscles contribute to back pain. And so when you come into my clinic, we can assess what your muscles are doing. And luckily, we sort of move in patterns, sort of synergy patterns, meaning the muscles work in teams. And so I don't have to assess every single muscle to find out what it's doing, right or wrong for you. We can see that there's a pattern. And when you come in and you're, kind of rounded, and you're slumped over, I can tell that the front, the chest muscles are going to be tight, and most likely the back muscles are going to be inhibited or weak. So I know that's where I'm going to maybe give you an exercise program to help that. So we have that sort of going on in the upper body. And then in the lower body, this is where the inhibited abdominals, if we're not tightening our abdominals, we're having more compression. We're having to use other muscles, right? When we stand up, like Dr. Hoell said, it used to be on all fours. We're two-legged stools. We have to tighten something, right, to keep us from falling over. The core is the best thing, because remember we talked about, we now know, right, that the back is supposed to be stabilized, and that's why abdominal or core training is the key, because when you have a good core, you can keep that lower body stabilized. You're not going to get the shearing forces, you're not going to get as quick degeneration, you're not going to get as much arthritis, and so that's where muscles and core strengthening can help. All right, so proper posture is prevention. And the reason why proper posture is prevention is because your best posture is going to minimize strain on those sort of three curvatures in your spine. And it would make more sense. I used to think, why don't we just have sort of a ramrod straight spine? That would seem like just kind of neat and efficient. But if you think of like a rebar, just a real hard, thing, it puts too much stress going right down the middle. So they actually have those curves. You can kind of see, here, this guy is the best guy. The curves there that actually distribute the stress. So that's what we're looking for. We want that curvature. And I just thought, I wanted to throw this in here. You see texting can actually damage your spine. The force on the neck when we're just standing up, kind of checking our phone, is about 10 to 12 pounds. You see the kids, especially kind of walking around like that. That's 60 pounds of force on your head. And that was kind of an interesting thing. The growing demographic for back pain, the people that had the growing incidence of back pain were actually teenagers in the literature. And you can kind of think why, right? With all the technology and electronics that they're using. So what is proper posture? Because it sounds like maybe you're something you like to do, right? Well, I've got your back. We're going to find out. So we're going to actually, if you feel comfortable, push your chairs back, and we have you stand up. We're all going to stand up and find some posture, finally, right? All right, if you want to reach your hands overhead, give a little stretch, decompress your spine. Excellent. So how are we going to find neutral spine? It's kind of a wide room. Good. Relax your hands, but keep standing. All right, I'll just stand here. Maybe you can see me. So you're going to take your hands, and you're going to put your hands on your hips. This is really the pelvis, but we're going to call it your hips. You're going to have your index fingers, so they're kind of pointing towards your belly button. And you're going to have your thumb, so it's pointing towards the back of you, your thumbs. So what you're going to do is you're going to tilt your pelvis forward and back. Okay, if you can, it might be tight or hard to do for some of you. That might mean you need some training there. But you're going to go forward and back, and I want you to find the place in the middle. Find the place in the middle. If you have to do it a couple times, that's fine. So all the way back and all the way forward, and I want you to find the place in the middle. Okay, you got it? You're going to feel some muscles activating, right? You feel like a little tightness maybe in the abdominals and the buttocks. So keep that, but relax your hands down. Don't move your pelvis. Keep it just like it is. That's kind of where your neutral spine should be. Does it feel kind of weird? Who thinks it feels weird? Yeah, you're thinking, well, this is, God, some of you are like, no, I'm good. That's good. So this is actually your neutral spine posture. This is your sort of best posture. That's a quick way to kind of gauge it. All right, you guys are going to have a seat down, but we're going to be exercising in a second. But have a little bit of a rest. You can also do that in sitting. So you can also kind of do that little trick with your pelvis in sitting, because we found that when your pelvis is level, that actually kind of translates to better posture all the way up to your neck and head. But what if you already have spine issues? Okay, let's say, all right, good. I'm going to do the exercises. I'm going to try to keep good posture, but sometimes degeneration happens. Slide says, is this you? I don't always go to physical therapy, but when I do, I expect to be healed after the first session. And I know you guys don't think that, but the point of this slide is that it is a process. And so we see a lot of the neurosurgeons patients after your surgery. You know, some of you have volunteered that you've had surgery for this. And the key is to remember there are 3 phases of recovery, and that's one thing that we really focus on. Whether you've had surgery or not, let's say you just came in because you had an episode of back pain. So the first phase is all about protective tissue healing, because it is traumatic when you have surgery. Someone said, no, it's minimally invasive surgery, and to me, minimal surgery is when they're doing it on someone else. But I mean, because it is traumatic, even though they're very good. And the recovery time, because of these incredible techniques, I have seen are better, and that's great because everybody's happy. So the first phase is about protective healing, finding your core again, because those muscles are traumatized and they're going to be inhibited, after the surgery. Then phase 2, and there's some criteria that's met there. It's anywhere from 3 to 4 weeks. This is after surgery. That's going to differ if you're just coming in for an acute back episode. Phase 2 is about core stabilization, endurance, and flexibility training, getting you back walking, biking, whatever you want to do, getting your heart rate up, getting you so that you don't, poop out after a few minutes of activity, because it gets tiring. And the last phase is kinematic muscle conditioning. And kinematic just means a series of movements that happen. So you can always tell, right, when your friend has back pain, they move different, right? So in phase 3, we looked at really restoring that natural movement and then back into whatever. Remember your game. So whatever your game is, that's what we look to try to get you back into doing. So I can give you the best exercises, and I have done that to some patients, and they're very fit and they're very motivated. They go to the gym every day, which is great. I think that's just a certain kind of person. But using good body mechanics is actually better than any exercise, because if you don't use the muscles that you're conditioning, they're not going to do you any good. All right, so remember, that's 4% of your day if you're working out an hour, but what are you doing with the rest of your time? How are you holding yourself? And that's why I wanted you to have that idea of what is good posture, because that you can control. And when you are sitting up in good posture or standing in good posture, you are using and actually activating those core muscles. So just to keep in mind, lifting, you can see the flexibility. If you really bend your knees and your hips, that requires a lot of mobility. So stretching is going to be very important. I like that the man is doing that. What are they doing? Yeah, so the right way, maybe that's vacuuming, I don't know. But it's going to matter whether you do housework, whether you're commuting, sitting in the car. You want to be sitting up nice and tall. And I think the automotive industry is trying to, get more business for neurosurgeons, because I think they're terrible seats. They're terribly designed seats in cars these days, and we're in our cars a lot. So a lot of people are into laptops. This is a big no-no here, putting it on the coffee table and kind of leaning down. So you might go home and think, how am I holding myself in positions at my computer workstation? Just taking out the trash. Just a few episodes like that can really irritate the back, and obviously that. So in your packet is an exercise, a 2-page card. Julie Bedeau did a nice job at putting this together. So in your packet, I just wanted to show you, it looks like this, is a 2-page card. Now remember, this is for you. I wanted this as a take-home, but doing the exercise correctly are so important. And unfortunately, I don't have time to take you through all these nor the space, but it's important that if you're not sure how to do them, that you see a physical therapist, that you get done the right way. Because it's easy to cheat, and if you found that posture a little funny or tight or troublesome, that might mean that you've got some imbalances in your body that you need to address first before you go right into it. But I wanted to go through one. So what we'll do is, if you're feeling good about it, so just push your chair back a little bit. I think we can do this, because this is my favorite one. All right, this is my favorite one, because if you're wanting to use good body mechanics, you need to have good leg strength, right? So sitting on the edge of your chair, and just put your hands on your hips again, that pelvis, just kind of line up a little bit so you don't feel like you're too arched, right, or too rounded, okay? And you can hold on to the table in front of you if you want to for a little stability. I'm just going to have you stand up. Good, and I'm going to have you sit down. We're going to repeat this 5 times. You're going to stand up, and you're going to sit down. As you stand up, I want you to think about squeezing your buttocks at the top. Okay, as you sit down, I want you to think about keeping your weight on your heels. Is anyone counting? I'm not counting, I'm just talking. This is how it goes in physical therapy. All right, I can make up a number. Let's do one more. All right, get the blood flow going, work off the smoothie. Good, all right, good, and have a seat. That was great. So that's one of the exercises in there. Can you kind of feel it in the legs a little bit? So you can use this as you want to. In summary, you can control your back pain. I think that's really my message here, is that there are some things that you can do. It doesn't always mean you need to go get an MRI when you have back pain. I know it's scary. And when you have nerve pain, that's the worst kind of pain, I think. So it becomes like very scary when you have even a couple days, right, where you can't do the things you want to do. So posture is a big key to controlling that and to preventing that. Body mechanics, huge. We touched upon that a little bit. So how you're using your body can make a difference on your spine. Exercise, you rest. But remember, it's the right kind of exercise. And stay in the game. Don't stop moving. That's my big recommendation. It's so easy to blow it off and say, I'm tired. It's important to just keep moving. If you golf, because there are a few hands, invest in a push cart. Don't carry or pull your cart. That just puts too much stress on the spine. Quality practice on the range. So have you seen yourself, or you've seen like your friend, they just hit bucket after bucket of balls? That's not good for your spine, especially if you don't have good mechanics. So quality practice on the range instead of quantity. And don't overswing. Stay within your limits, and that could apply to anything that you do. Remember your limits. I know it's nice weather finally on Cape Cod, and we have all the yard work to do. Pace yourself, 20, 30 minutes at a time. I know it doesn't sound like a lot. It gets overwhelming. You have to do a lot, but try to pace yourself. Work your way up into it. Thank you. Any questions? Okay, you.
Yeah, and these exercises, you're only doing it on the right side. That seems a little crazy.
We're going to walk in circles. No, I'm just kidding. I'm kidding. You're right. They may show just the right. It should be on both sides. I think I'm glad you said that. No, you would do the other side. So for these, if it says right, do the left, if there is a right and a left. Yes. Yes.
I've been told by 3 neurosurgeons that my chronic back pain is no surgery for me. So I went to physical therapy about a year and a half ago and have been doing Burdenko exercises in a pool since then. And so I'm just curious what you think about Burdenko exercises.
I think they're fantastic. Burdenko exercises is a series of exercises in the water developed by Igor Burdenko, an exercise specialist. I think he's in Lexington. That's where he's from. But yes, water therapy is fantastic. It's less on the joints. I think that's fantastic. The key is when you're in pain to try to get to a point where you don't have pain with exercise. Sometimes water is where you have to start. And I think that's fantastic. You can't underestimate the power of water. So that's great. And a question? Oh, we'll go all the way on the end.
Excuse me. Thank you. I have a question about the controversy, if it is controversy, about pelvic tilting versus no pelvic tilting.
So pelvic tilting is good. You need to be able to pelvic tilt. Pelvis has to move to walk normally. As we walk and put one foot in front of the other, the pelvis has to move. When you don't, you end up walking like Tim Conway from the Carol Burnett show, right? So pelvic tilting is good. Are you referring to the position of the pelvis?
Yes.
With exercise?
Yes. Yeah.
Because I've heard that. So, the pelvis is the bowl and the three bones that sit on below your spine. The key is neutral spine. That's what really we're looking at, and literature supports a neutral spine. So not too far into a posterior tilt, we call it, and not too far in the anterior. And that's what I had you do in that exercise today, was kind of find your neutral. So we're not trying to force into, a lot of the therapy was in the 20 years ago, use your abdominals and you have to pull your pelvis in, and it became too much. People were overdoing. And so a neutral spine, and that's going to be a little different for everyone, is the best.
And when you're doing exercise on your back, should you keep the curve or try to put your spine, straighten your spine?
Right, so the question is, did you all hear that? When you're on your back doing exercises, should your back be really flat or should you keep the curve? I always recommend you keep the curve. I mean, that's the whole point, is that we want to exercise in a neutral spine. So it's good to engage, and so you will feel the back flatten a little. But usually what I say is with your back exercises, you should be able to have a little bug crawl underneath you. Not that is what you want to happen, but you should have a little space in between there. Don't be too aggressive. That's another big thing. Don't be too aggressive with the exercises. They should feel challenging, but okay to do. That's a good question. Thank you. Okay, thank you very much.